Now, we are hearing different sort of expert opinions on the actual number of cases from tens of thousands to 100,000, along with also the forecast on when this outbreak could peak in a week or 10 days in April and so on. I mean, when are we likely to see some improvement in the situation?
Yeah, and so the answer, unfortunately, is that it depends. And it depends on how effective the measures are at preventing the spread right now. At the moment, every person who's got the virus is giving it to, on average, at least two other people. And so the virus is still spreading and it's basically uncontrolled. But if the lockdowns of entire cities and reduction in the movement of people start to take effect, then we should see that number coming down and hopefully going below one, which means we're finally starting to win. Now, as to countries pulling their nationals out of China, I can see why that would be a good sort of public relations move and would make people feel comfortable and confident. But from an epidemiological perspective, this is potentially importing the virus back into other countries and helping it spread. And so that's something to consider, I would think.
Professor Newman, I want to get your thoughts on this. Not to underscore the gravity and seriousness of the situation with the spread of coronavirus, but I mean, I was just at the doctor's yesterday, and my doctor said to me that, we need to sort of temper, sort of how we're handling the situation and how we're looking at it, because there's been a lot of parallels that have been drawn between, coronavirus and also SARS. And whilst the cases have surpassed that of SARS, the deaths haven't. And he made a pretty interesting point to me yesterday, and he said that if you look at the statistics as a percentage, deaths as a percentage of overall confirmed cases, it's much, much lower than SARS. I mean, should we draw any comfort from that?
It seems comforting at first. And while this virus isn't exactly the same as SARS that came out in 2002 and 2003, it is part of that same cluster, definitely. And so we have to treat it as being at least similar to SARS, I would say. In terms of the number of cases, yeah, we're just below the amount, I believe, that were infected in SARS. I think that was around 8,000, but I expect we will be over that number by the end of the day today. Right now, I think you may be looking at a difference in testing and in the number of people who are getting tested, particularly in the early parts of SARS, the first month or so. The results coming out of China were very few and they were being very controlled about what was released. And so the thought is that there were actually a lot more cases there that may have been mild cases that were not ever officially tested or picked up in the original SARS. Now, in this outbreak, it looks like they're testing absolutely everybody. I know, at least in the United States, there have been about 10 times as many people tested as have come up positive. And so they're really trying to check and make sure that we have control of this virus as far as possible.
Professor, based on your experience and knowledge, how do these things usually end? Is it, sort of a better weather pattern or better health measures? What does it look like usually?
Yeah. So, as a person who likes to make antiviral drugs, things that actually slow down the virus, I can say that's probably not going to be the end, and a vaccine is probably not going to be the end. It's old fashioned stuff like quarantine, basically keeping infected people away from healthy people, that actually beats viruses like this. Now, the risk is that there are only so many quarantine facilities available in mainland China and only so many facilities to keep people properly treated while they're being treated for the virus. And so, if there are too many people that turn up sick and they overwhelm the systems that are there, that is potentially a risk. Now, we've seen China build new hospitals very quickly in the last couple of days. They've broken ground. And so, I believe they realize this possible risk and are trying to combat it, which is actually very good news.
Well, speaking of the vaccine you just mentioned, I mean, scientists are moving very quickly to create these new coronavirus vaccines. But from past experiences, by the time the drug is tested and shots are, in use, it's already too late. So, what can be done to overcome this sort of delayed response?
Yeah, scientists have a job, and our job is to be right. We have to be careful, and we have to go slowly, and we have to make sure that we don't make things any worse. That is not really compatible with fighting an outbreak where you almost want to fight fire with fire and go extremely quickly and very hard. The problem with coronaviruses is that making vaccines has proved difficult for most coronaviruses. There's one coronavirus that's vaccine rather that's licensed in cats, but it actually makes the disease worse if they get a certain strain. There's one that's licensed in chickens, but it actually kills a very small portion of the chickens, but it is not as attenuated as you like. For whatever reason, coronaviruses seem to be very good at the game of immunological hide and seek, basically hiding inside your body so your immune system can't find them. And this makes them very difficult to vaccinate against. They also seem to change pretty quickly. And I would like to see a vaccine, and there have been candidate vaccines for the original SARS, but this virus is different enough that it'll be starting from ground zero all over again in developing a new vaccine.